Namaste. I am Dr. S. Sacchidanand, Vice Chancellor, Rajiv Gandhi University of Health Sciences, Bangalore. Today, I would just like to speak to you regarding this COVID-19 epidemic that has engulfed all of us. We are in a state of lockdown as per the Government of India directions, and all of us are quarantined at home now. Let us also prepare for a worst case scenario wherein probably India will enter into third epidemic stage or even fourth epidemic stage also. At this point of time, let us see what our strengths are and how we can combat this epidemic and save our fellow countrymen and also our fellow citizens. It's very important. What I would suggest is, let us list out the available human resources that we have at our disposal, probably doctors, nurses, health professionals, volunteers, psychologists. All these people are very, very important at this point of time. So let us list out and keep the names and addresses and contact details of all these health professionals who are likely to be involved in the future stages. Let us also list out the infrastructure that is available with us. What is the space that is available with us? In case such an emergency happens, do we have enough space to accommodate the inflow of patients that we may have in the future? One. What are the equipments that we have, and what are the beds, number of beds, ventilators, then personal protective equipments. All these things we should be ready, keep it ready with us. That's one thing, so that we'll be prepared to face any such emergencies. Then what are the lab testing facilities? Do we have lab testing facilities to test the throat swab and further manage the patients when they are admitted with us? Any other lab requirement that may arise, we need to keep ready everything there. We need to keep prepared about the transport facilities that we have, like ambulances, vans, drivers, enough petrol and diesel, so that whenever such a situation arises, we need to transport men and material to and fro to the hospital and also to other places wherever they need to be referred to. So those transport infrastructure also has to be planned and kept in reserve. Apart from that, most important is training of the health professionals. Rajiv Gandhi University of Health Sciences has been assigned the job of training health professionals across the state. We will take it up one by one, so that we need to train physicians, pulmonologists, anesthesiologists, intensivists, emergency care providers, the nursing professional and other healthcare professionals who are available with us. All of them have to be trained. We know all of us are experts, but at this point of time, all of us have to be speaking one language. We need to get trained and do things according to the protocol as described by either WHO or Government of India or Government of Karnataka. We need to follow guidelines, we need to follow protocols so that we don't make mistakes. So even though we are experts, we need to get trained and do things as required as per the protocols laid down by the authorities. In fact, we need to identify the infrastructure for training also, whether we have enough training facilities within our premises. That's one thing. And as Rajiv Gandhi University, we will also plan and impart training to all healthcare professionals who are desires to get trained to take up this system. And most importantly, after this training, we need to have a plan for deployment of our manpower. Whatever manpower is there at our disposal, be it doctors or nurses or even for that matter healthcare professionals, allied health science technicians and other people, we need to have a plan, contingency plan as to how we deploy this manpower which is available with us. Then most importantly, very recently Government of Karnataka through Karnataka Medical Council has also issued directions for online consultation. This online consultation can be done, it is allowed now, and telemedicine facilities have to be established in colleges and also clinics for that matter. Doctors can do online consultation. However, they need to follow a protocol. They need to maintain records of patients whom they consult. As far as possible, if the patient is known to them, then providing teleconsultation is very good. And if the patient is fresh, and please refer them back to their own general physicians whom they have been handling much earlier. So this is one important thing. What I would suggest to this thing is to disseminate correct information to anyone who seek such information. It is imperative on our part, on the part of all healthcare professionals, to disseminate correct, authenticated information to everybody. So that is what is important. Government of Karnataka is now establishing what are called as fever clinics, where any patient can walk in or go there and get tested. If the patient or a person has got any doubt that he has contacted COVID, come in contact with COVID patients, they can walk into these fever clinics, or even any patient who has got fever, cough, or sneezing and respiratory distress, difficulty in breathing, they can walk into these fever clinics where they will be examined by doctors and appropriate suggestions and guidance will be given to them. If they are suspected to have COVID symptoms, they will be referred to what are called as first responder hospitals, where swab taking facilities and isolation facilities are available. If the suspected cases, the swab is taken for testing and confirming COVID-19 infection, then they will be kept under surveillance for about 1 or 2 days, depending on the time taken for a lab test report to come. And then if they are found positive, then they are shifted for isolation for about 14 days. This is what is the plan. And if the condition improves and they are at the end of 14 days, if they improve, they will be shifted back to their home and again quarantined for another 14 days. So this is what is the treatment plan, roadmap that is being planned. If at any point of time the symptoms worsen and the case they become moderately severe or severe cases, then they will be shifted over to what are called as COVID hospitals. And in Karnataka now COVID hospitals are being established. In Bangalore, Victoria Hospital has already been identified. There are 2-3 other places which are now being also earmarked as COVID hospitals. All these facilities will be available in the next few days. There is no need to panic for and create scenes. We all need to, at this point, cooperate, be on the vigil, be alert, and then follow all instructions that is being issued by Government of Karnataka on time-to-time basis, and then fight this menace, this epidemic together. And together, I'm sure all of us can eradicate this condition and control the epidemic at a very early pace. Thank you so much.